Some of the health risks that we see in the older population, older adult population, are coronary artery disease, hypertension, diabetes, stroke, cancer, arthritis, osteoporosis, dementia, and chronic pain. Older adults need to be immunized against diphtheria, tetanus, pertussis, varicella, seasonal influenza, herpes zoster, and pneumococcal infections. Our elderly population needs to be educated on health screenings and the importance of them, such as annual health screenings of hearing, fecal occult, blood test, and mental health screenings, which is important to do periodically to assess for signs of depression. Nutrition is another important education that needs to be addressed to the elderly. Because the elderly go through a lot of gastrointestinal alterations, it is important to adjust their nutrition with that. Many older adults are on a lot of medications, which can alter the taste of food and their appetite. So it's important for them to be on a diet that can give them the best amount of nutrition, vitamins, minerals to support them. It's important to tell them to increase their intake of vitamins such as D, B12, E, folate, fiber, and calcium. They also need to increase their fluid intake to minimize the risk of dehydration and prevent constipation. Because a lot of elderly tend to become incontinent, they want to limit their fluid intake so that doesn't happen to them. But again, they need to be educated on the importance that they can become dehydrated and become constipated if they do not increase or have adequate fluid intake. They also need to limit their sodium, fat, refined sugar, and alcohol intake as well. Injury becomes a big thing in the elderly population because they're more prone to it. So it's important to educate them on how to prevent injuries. So, like installing bath rails, grab bars, and handrails on stairways, removing throw rugs, eliminating any clutter that can make them fall or anything like that. Instruct the elderly population on how to properly use ambulation assistive devices such as walkers and canes. Having adequate lighting is important, and reminding the elderly about wearing their eyeglasses and hearing aids. And again, the elderly, older adults, they go through a lot of physical and cognitive changes. So it is necessary, imperative for us to educate them on these changes so they know how to adapt to these physical and cognitive changes.